Welcome to the press briefing. On stage, we have Dr. Albert Au, Principal Medical and Health Officer, Communicable Disease Branch of Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager from Hospital Authority. Dr. Au will report to us the number of cases. Hello, good afternoon, everyone. I'd like to report to you the number of cases we had on the 3rd of April yesterday. Those confirmed through PCR, we had 1,589 cases, including 264 confirmed by HA, 169 confirmed by a public health laboratory, the remaining 1,151 through private labs. For RAT, yesterday, we had another 1,549 confirmed through RAT and reported to us. So PCR plus RAT together, we had 3,138 positive cases. As of now, in the fifth wave, Hong Kong has 1.16 million, 1,129 confirmed cases. 370,964 were confirmed through PCR test, 430,965 cases through RAT. In yesterday's cases, 12 were imported. The remaining 3,126 cases were local cases. Among the imported cases, 10 were found at the temporary sampling center at our airport. There were 2 cabin crew members arriving on the 3rd of April, one from South Korea via CX 3641, another one from Germany through Singapore on 532 SG. For the remaining 8 cases tested positive at the airport, 2 arrived on the 2nd of April from South Korea. 6 arrived on the 3rd of April from the Philippines, Thailand, India, Malaysia, Spain, and Ireland, respectively. Now, for the 2 remaining imported cases, they were identified at a quarantine hotel, one on the 1st of April, arriving from Germany, a tourist, and the second arrived on the 23rd of March from Singapore. As regards genome analysis, the Public Health Laboratory did 1,235 samples. Among them, no sample was found positive to L452R. 1,223 cases were confirmed negative to L452R, meaning they were Omicron cases. For the remaining 12 samples, the viral load was too low. As regards outbreak in care homes yesterday, there was one care home who had cases for the first time in this wave. One case involving a resident was reported to us, tested positive by RAT. So far, in elderly care homes, we have 784 RCHEs with cases of outbreak. For residential care homes for persons with disabilities, 287 care homes had outbreak or cases. There were 43 care homes that had previous cases of outbreak, with new cases reported to 43 RCHEs involving about 50 residents, and there were 15 care homes for the disabled with previous cases. They reported new cases to us involving 16 residents. As regards number of deaths, so far in the 5th wave, we have a total of 8,049 cases of death, 90 more than yesterday. The death rate is 0.69%, aged between 11 months to 112 years old, medium age 86 years old. There were 8 below 18 years old, 314 aged between 18 and 59, accounting for 3.5% of the total. The remaining 7,725 cases of death involve people over 65 years old, accounting for 96% of all the deaths. Among them, 5,710 deaths involve elderly persons at 80 or above, accounting for 7% of the total number of deaths. For the new death cases yesterday, 5 were reported through the forensic department of the Department of Health. 4 males, 1 female, aged between 74 and 88, all with chronic diseases. As for vaccination, among the deaths, 67% of them were never vaccinated. 22% of the cases had only 1 jab. For those with 2 jabs or above, they accounted for 11%. As for the death rate, so far, those who were never vaccinated, the death rate is 3.2%. Those with 1 jab, 0.96%, 2 jabs, 0.14%, 3 jabs, 0.03%. Those never vaccinated or with only 1 jab, their death rate is 29 times higher than their counterparts. For those over 85 years old, those never vaccinated, now their death rate is as high as 16.4%. 1 jab, 6.8%. 2 jabs, 3.3%. 3 jabs or above, 0.98%. For those over 88, never vaccinated 1 jab, compared to those who have 2 jabs or above, there is a difference of 5.5 times. Dr. Lau will report to us the situation with HA. Good afternoon. We have 1,169 confirmed cases being treated at public hospital, Hospital North Lantau, Hospital Infection Control Center, HA Infectious Disease Center, and also AWE treatment facilities. Yesterday, there was another 7 cases reported critical, 19 in a serious condition, and 75 critical patients are being treated at ICU. As at 00 hours today, in the past 24 hours, 77 patients tested positive passed away, 47 men and 30 female, aged between 41 and 99. For those who died yesterday, 26 came from care homes. Among those who passed away, 41 had no vaccination information. 21 had 1 jab. That is, 62 patients who passed away were not fully vaccinated, accounting for about 80%. 13 patients had 2 jabs, 2 had 3 jabs. Among those who passed away, those who are over 65 years old, we had 65. I'd like to report to you 5 younger patients who died. One is a 40-year-old patient who had many chronic diseases, including diabetes, protein urine, and hypertension. He was obese and was a smoker. When he was admitted, his main cause was an abscess at his buttock. For over 2 weeks, there was pain and also pus at the same time. He did say that he was not breathing easily. He had difficulty in breathing for more than a week. He did not have any fever or cough. On testing, he was positive with COVID. He also had an operation because of the abscess. Unfortunately, his situation continued to deteriorate, and after the operation, his blood pressure fell and he passed away yesterday. So the patient passed away soon after he was admitted, so his case was referred to the coroner's court for further investigation. Another one is a 51-year-old patient When the patient first came to the public hospital, it was on the 8th of March. He came, or the person came, because he had some renal problems. And we found that he was at the end stage of his renal failure. And the person wasn't aware of his renal problem all along. When he came on the 8th of March, he was found to be at the end stage of his renal failure. And he also was coughing. RAT tested negative. But then when he was admitted to the ward, the nasopharyngeal swab tested positive. And he was discharged on the 15th of March. He was in a stable condition. Or rather, on the 15th of March, well, he was originally in Ratanji Hospital and then transferred to the Eastern Hospital for his renal failure. And on the 23rd of March, after being treated at Eastern Hospital, he was discharged. And on the 3rd of April, he suddenly fainted at home. The family members called the ambulance, and when the ambulance arrived, the resuscitation was needed, and he passed away at the hospital. Another patient is a 55-year-old patient. He had lung cancer, which has metastasized to the bones. So he was a chronic patient and he needed follow-up consultations. And he was admitted for shortness of breath. And his condition was poor and he passed away, unfortunately. Another patient is a 56-year-old patient. He suffered from a lot of chronic illnesses, diabetes, hypertension, Parkinson's disease, and he has a heart failure as well. When he was first hospitalized, he was found to have some swelling problems and something got into his lung leading to pneumonia. And then he tested positive in the hospital. The last hospital is a 59-year-old patient. He had some rare blood vessel problems. So the blood vessels were constricted and were easily blocked. In 2005, he had brain hemorrhage. And before hospitalization, he needed to be cared for on a long-term basis. His mobility was impaired, and he has an opening on his stoma, and he was a chronic patient and needed to be well cared for on a long-term basis. Because of data lacking, from the 3rd of March to the 22nd of April, there were 8 patients passing away at public hospitals, 4 males, 4 females, aged 73 to 101. In the past day, 382 patients recovered and were discharged, and 5 patients were detected positive on admission screening and testing. And 13 patients staying in the same ward were listed as close contacts. On HA staff, 21,254 HA staff tested positive. 19,152 had returned to their duties. So much for my report. The floor is now open to questions. Please use the mic. Please identify your organization. The one in the brown sweater in the middle. I'm from Phoenix TV. The SL government is appealing to members of the public to do RAT for 3 days over the weekend. How many positive cases do you expect to identify, and how will you cope with the large number of possible positive cases identified? And then we see that at the community testing centers, there are still a lot of slots available. So would you be appealing to the public to do PCR tests as well? Thank you very much for your question. The SL government has been distributing to all households in Hong Kong the anti-epidemic service bags. And these include RAT kits. And we encourage
Hong Kong people to do RAT over the coming weekend on a voluntary basis. The aim is to detect a majority of the cases in the community so that we can implement public health measures to isolate these people, and if needed, they will also be treated. So we want to cut the transmission chain in the community as much as possible. Apart from doing RAT, the government is also encouraging members of the public to do tests at the community testing centers and the mobile testing stations where PCR tests are conducted. Now, for those who are on compulsory testing notice, they have to take the test at the community testing center. We do have the available capacity to provide this for the people. I'm from Now TV. First, the question about the trends in the pandemic. We still are seeing a 4-digit figure. For 2 days in a row, the figures are in some 3,000s. So what is your assessment of the situation? Would you expect that the 4-digit figure will persist in the whole of April? Do you think that the extent of the drop is significant or not? And then I have a question on the oral drugs. Private doctors can get the oral antivirals, but in interviews, some private doctors said that not many private doctors are expected to join the program, and they are particularly concerned about the distribution or the delivery of the drugs. How can you improve on the delivery mechanism? How would you encourage more private doctors to join in the plan? Thank you. First, about the trends for the pandemic. In recent days, there has been a downward trend on the number of infections. Well, this is clear. Although there has been a decline in the number, but we are still seeing infection numbers to the tune of a few thousand. It is still at a high level. This means that in the community, several thousand people are infected every day, and many of these come from RAT tests. That means the viral load is high. So there are still many transmission chains in the community. So Hong Kong people should still observe social distancing measures to prevent a rebound in the infection figures. We also encourage Hong Kong people to do tests through RAT. Once they test positive, then necessary follow-up action can be taken. We hope to identify and detect cases in the community as much as possible and isolate the patients as early as possible. And if they do the RAT, we will be able to assess the situation in Hong Kong. As of yesterday, the public hospitals have administered 23,700 doses of the oral drugs to patients. In Hong Kong, we have both a public and private medical system, and private doctors play a significant role in the healthcare scenario in Hong Kong, especially in the fifth wave. We are seeing a lot of private doctors helping to treat COVID patients. We hope that private doctors can provide support to patients. I understand that the government has been liaising with private doctors. Later on, a letter will be sent to them to set out the drug delivering mechanism. And we all know that the e-health record sharing system will also be enhanced. So the information on prescription of oral drugs by private doctors to patients will be put on the system, and the HA will fully cooperate with the private doctors. We have one common goal. We hope that patients can obtain the oral drugs as soon as possible. If you are over 60 years old, or if you are under 60 years old and you are chronic patients, or you are immunocompromised patients, if you test positive for COVID, maybe you are suffering from mild symptoms, but in any case, you should seek medical attention. You can also visit the designated clinics. You can do it, make an appointment through HAGO. And for those who are suitable to take oral antivirals, well, they will be prescribed the same. And very soon, private doctors will be another channel for patients to get such oral drugs. Maybe some patients think that their symptoms are very mild. They don't think they need to seek medical attention, but I think these patients should also see a doctor as soon as possible.
I'm from Ming Pao. I'd like to ask about the overall figures. Now, today, CHP has got a breakdown for RCHEs and RCHDs. Can you tell us, in the fifth wave, the number of RCHEs and RCHDs that have cases respectively, and also the ratio, and also the number of deaths? We have less than 100 new deaths reported. How does the CHP assess this drop in the number of deaths? Does that mean that the epidemic is easing? Yesterday, there was a case involving a 51-year-old with poor renal function. It was mentioned that on the 8th of March, he tested positive. And then was his viral load still positive yesterday? Did he die off or die with COVID? And regarding universal RAT, can you expect the number of cases to be identified? The first question, on the number of RCHEs or RCHDs with cases. In the fifth wave, further we'll talk about RCHEs or RCHDs. Most of them have got cases in or outbreak in the fifth wave. In some care homes, their outbreak is over and they haven't had any cases for a long time. In the fifth wave, 784 elderly care homes have had cases, accounting for 97.8% of the total number of RCHDs in Hong Kong. And we have 287 RCHDs with cases in the fifth wave, accounting for 95% of the care homes for the disabled. Over 50% of residents have been affected in this wave. In the past week or so, we can provide a breakdown of RCHEs and RCHDs because each care home is required to report new cases to us, and we will approach them and arrange for new cases to be admitted to isolation facilities. In the past week, in the past 7 days, we have 200-odd RCHEs continuing to have new cases reported to us. For RCHDs, about 80 or so homes. The RAT to be conducted at this weekend. Now, we encourage everyone in the community, after receiving our service back, to make good use of the RAT kits in it. And in the coming weekend, do conduct tests on yourselves so that we can identify the silent cases in the community. We cannot expect the number of cases to be identified. It all depends on the public's participation. I hope the community can treasure this opportunity. We all do our part in conducting the test. And if you are infected, you should learn about it as soon as possible. And if you test positive, please declare to us through our declaration system online, and we will issue isolation as well as quarantine orders to respective citizens. We hope that we can identify as many cases as possible in this exercise so that we can identify hidden cases in society. We cannot expect the number of cases to be identified, but then our computer system is already ready. We have seen a slight drop in the number of deaths. We are happy to see that. After all, we don't want to see too many deaths. There can be a few possibilities. First, we have seen a continuous drop in the number of confirmed cases. The number of confirmed cases should have a bearing on the number of critical and serious cases, because they're bound to be confirmed cases that deteriorate to become critical or even death cases. While we have seen a drop in the number of death cases, but the fact that most of the deceased are elderly and many of them were never vaccinated. Among the 77 patients who passed away, 8% of them were not fully vaccinated. Although we have said time and again, now if you have yet to receive one jab or the second jab or the third jab, now please do so as soon as possible, because as a fact, all researchers around the world have told us that vaccination can reduce the number of complications and possibility of death, and observe a good hygiene, observe social distancing measures, wear a mask, and refrain from gatherings. Today, we saw many people coming out, taking part in all sorts of activities, and some were not wearing masks, some were smoking with mask off. So you're not just not protecting yourself, you're endangering people around you and even your family members. And if you have any symptoms, remember to consult a doctor as soon as possible, because the new oral drugs can really reduce the risk of condition deteriorating or death even. So the case involving a 51-year-old patient, on the 8th of March, he went to the A&E department because he felt unwell. His renal function was found to be very poor, and he could be classified to be an end-stage renal failure case, and he had coughs. He tested positive. Subsequently, he was admitted and treated in hospital, and then he was referred to a larger hospital to attend to his renal problem. When he was discharged, he had recovered from COVID. Perhaps he was discharged on the 23rd of March. But then on the 28th, he had a test with a very high CT value at 34. So for reasons yet unknown, he fainted at home yesterday. So an ambulance was called. He received resuscitation. Unfortunately, he had passed away, and his death, of course, is yet unknown. Whether it was due to COVID or some other reasons, we don't know. So this case has been referred to the coroner's court for an inquiry.
The next one, the gentleman in red over there. I'm from Orange Daily, Leung. I have a few questions. Well, there are RTD operations daily, but it's found that there are fewer positive cases detected. Well, how long will it take for us to be seeing zero infection during RTD operations? Recently, positive cases and the percentage of positive cases in RTD cases has been declining in recent days. 3 weeks ago, the figure was over 10%, and in the past week or so, positive cases RTD operations were at a percentage of 2 to 3%. So there has been a significant drop, and that is in line with the development trends of the pandemic. Overall, the infection numbers have been declining in Hong Kong. We made analysis of the positive cases detected at RTD operations. We should take note that if the residents were confirmed before the RTD operations, these people did not have to take the test again. So the cases identified at RTD operations are all new cases. And in these buildings subject to RTD, there are still residents staying there who are on quarantine. And we are also working on buildings where the sewage samples is found to have a high level of our virus. So we would like to identify the silent carriers. So as to when we will be seeing zero infection during RTD operations, it depends on the overall trends of infections in Hong Kong. As the number of infections continues to drop, that number will also drop. So we are really targeting buildings with virus found in their sewage samples in our RTD operations. So naturally, we would be able to detect positive cases in RTD operations.
From SCMP News, a few English questions. Earlier, the Education Bureau has announced that the whole of Penny's Bay will be reserved for DSE candidates who are close contacts or are infected but are still fit enough to sit for the exams. Can I ask currently how many people are staying in Penny's Bay right now? And how will its reservation for DSE students affect the supply for the overall quarantine centers? Where will the patients currently staying in Penny's Bay move to? Will there be a shortage of isolation facilities? My second question is, earlier a medical expert has estimated about 10,000 new cases can be identified from the voluntary red mass testing. So is this also the CHP's estimate, and do you think the period of the red test is enough to analyze the overall situation? Are authorities also better prepared this time to deal with the potential sharp rise of cases, if any, as compared to the last few months? And my last question is on the imported cases today. There's a number of countries mentioned in today's imported cases and the flights that are affected. Will there be any flight bans coming up? Thank you.
Thank you for your question. For the first question, the Education Bureau has announced the arrangement for DSE students who are confirmed cases or who are household or close contacts of confirmed cases. They have the option of taking the examinations in Spanish space. I don't have the exact number of cases who are currently isolated in Penny Bay right now, but according to information, there are over 3,000 units in the Penny space, and we think that it is enough to cater for the need of the DSE students who are confirmed cases or close contacts, and the government will have contingency plan. If the number exceeds this number, I think the government will make other arrangements in order to allow these confirmed cases or household contact or close contacts who are DSE candidates to take examinations according to their choice. For the second question about the number of RAT positive cases, which will be detected through the voluntary testing in the coming weekend. We don't have any estimation, and we encourage all the citizens in Hong Kong to take the RAT tests during this weekend so that we can identify the silent or the hidden cases in the community and offer treatment to them, and also put them under isolations to cut all the transmission chains in the community. And also through this exercise, we hope that we can collect more data on the actual situation of infection currently in Hong Kong. For the last, could you repeat your last question? The government has a criteria for flight suspensions. According to the latest arrangement, for flights, if there are 3 or more cases detected upon arrival at the temporary specimen collection center at the airport, then the airline will of the flights will have to be suspended from that particular destinations for 7 days.
The next question. The lady at the very back. I'm from Cable News. 3 questions. First, the ECB announced that the Penny Bay will be turned into a special exam center. Now, there are people now staying in the Penny Bay. Do they have to be relocated to other facilities? Or is it the case that before the DSE exams, the Penny Bay will not take in any other people? Now, a question on oral drugs. You have prescribed 23,000 doses to patients. What is the distribution? What is the breakdown of these 2 types of oral drugs? And for the 47-year-old female patient, how many jabs did she take? You said that she had suffered from shortness of breath for a week. Is it because of her infection, or did she die as a result of the infection, or other causes? Right now, there are over 3,000 units at Penny Bay. Right now, it is a community isolation facility accommodating the infected cases, and is being managed by the Civil Aid Services and the HA. The EDB has just announced that candidates who are confirmed patients will be arranged to be isolated at Penny Bay and also to sit for the exam in Penny Bay. There are different zones in Penny Bay's isolation facility. Not the entire Penny Bay facility will be used for exam purposes. There will be different zones at the Penny Bay. Some are for confirmed cases, others for close contacts. The EDB, or rather the CHP, will provide guidelines on the arrangement so that there will not be cross infection. Well, one of the oral drugs is molnupiravir. Up to the 3rd of April, we have prescribed the drugs to 16,158 patients. And for Paxlovid, we have prescribed the medicine to 7,600 patients. On the 41-year-old patient, the patient is a chronic patient. He's suffering from proteinuria, diabetes, hypertension. He also smoked. He told us that he had an abscess on the buttock for 2 weeks, and it was painful. A week before he was hospitalized, he also suffered from some shortness of breath. He didn't have a fever or cough back then. He was admitted to the hospital mainly for treating the abscess, and a surgery was operated on him. And after the surgery, he was arranged to stay in ICU. For all patients being hospitalized in the hospital, that would be a screening test. And he tested positive. His CT value was 33. Now, after the surgery, his condition had not improved. He still suffered from low blood pressure, and he was on a lot of medication. And on the 3rd of April, he underwent another operation. And his condition was quite poor after the operation, and he passed away in the morning of the 3rd of April.
Next, the gentleman in the front. I'm from .tv, .news. I've got 3 questions. Tomorrow is the Qingming Festival. Although the number of cases is falling, are you worried that there will be large crowds as a result of the grave sweeping activities? I'd like to know measures that have been recommended to the management of graveyards. And then the government has distributed anti-epidemic service bags, and in between the 8th and the 10th of this month, members of the public are advised to administer tests on themselves. I'd like to know whether everyone in Hong Kong knows about this appeal from the government so that they will follow suit. I'd like to know whether you will ask the community to help to spread this news. And the third question is, all along, councillors have said that foreign domestic helpers on return to Hong Kong can follow the practice of Singapore. They should be put under quarantine for 14 days before they start their work to lower the infection rate. Do you think this is feasible? Well, we have the Qingming Festival and also the long Easter vacation. We're concerned the members of public after 2 months or so of social distancing measures and staying at home may want to go out. While the number of cases is dropping, we still have a few thousands every day. So the risk of infection in the community is still high. So at all times, during the holidays, when members of the public go out, they must wear their masks properly, whether indoors or outdoors, to avoid unnecessary gathering and cross-family gatherings. They should observe personal hygiene at all times. And please go to crowded places unnecessarily, because that will increase the risk of infection. And if you have symptoms, you should administer an RAT as soon as possible. The government has appealed to the public to administer RAT on themselves over the weekend. The more people taking part in the exercise, the more useful it will be. I understand that government departments, the civil service, and voluntary organizations have helped to distribute the service bags to different households. And volunteers are helping as well. We hope the public can cooperate and take part in the RAT exercise as far as possible. And as for quarantine measures for foreign domestic helpers, the administration has long adopted a very stringent standard. Everyone is required to have a negative PCR test before boarding a plane, and then on arrival they have to hold a test arrangement, and they have to stay in a quarantine hotel, during which period they have to be tested a number of times, and so that we can identify confirmed cases. Any other questions? The last one over here. I'm from Hong Kong 01. It was mentioned that 2 patients passed away although they had 3 jabs. I'd like to know their conditions. Given that someone who have had 3 jabs passed away, do you think that it is necessary to introduce a mandatory second booster in Hong Kong? Now, for the 2 cases with 3 jabs, we have checked the records. One is a 75-year-old patient with many chronic diseases. There is a hyper pressure and also myocardial infarction. The patient was admitted with shortness of breath, and then he attended our A&E department on the 14th of March. The patient received treatment at A&E department. The patient had other health issues. His parathyroid and also his kidney. The kidneys were also had problems. Another patient was an 88-year-old patient. Again, the case had different chronic illnesses. He had hepatitis and also hypertension. The patient attended an A&E department on the 11th of March. There were signs of pneumonia as well. Both patients were old and had many chronic illnesses. We cannot say that with 3 jabs, the patients still passed away. That means vaccination was useless. But as said by Dr. Au, 3 jabs can very much lower the possibility of death for COVID positive patients, and that's why we have impressed this on the community time and again. Even in RCHs, when we discussed with staff there, we were told that about 10% of the family members were unwilling to allow their elders to be vaccinated. We fail to understand, is it because we haven't explained clearly enough to them, or is it the message hasn't got across to them? So if you have elderly members of your family living in RCHs, if you have concerns about vaccination, discuss with your doctors to see whether they can explain to you, to allay your concerns, so that you can be persuaded to allow your elderly family members to receive the vaccine. After the first jab, the second and third jab will be easy, so they should start with the first step. The breathing answer. The speaker is not speaking into a microphone. What 3 jabs? Well, I don't get it. I don't have record. I just know that they received 3 jabs. I'm sorry.